Salam ceria dan salam sejahtera. Saya Dr. Sanceelah dari Klinik Pergigian My Dental Care. So untuk hari ini kita bersiaran langsung untuk bagi sedikit info pasal teeth whitening, pemutihan gigi. So selalunya kita tak aware pasal whitening tu. So I will just give a brief introduction on it lah, macam mana and how and why we do whitening. So okay, so you can see like apa itu whitening? So whitening ni selalunya kita buat untuk kecantikan. Kecantikan maksudnya kita tak satisfied dengan warna gigi kita yang tak putih. So kita nak jadikan dia lebih putih, then we do this procedure called whitening lah. Next. Okay. Then okay, so when and why we can recommend whitening. So for just now, macam tadi kita cakap kita tak satisfied dengan warna gigi kita. So for the warna gigi tu kita ada dia punya akibat kenapa warna gigi kita tu jadi macam tak putih. So we got two types of causes, that is intrinsic dengan extrinsic. Intrinsic maksudnya dari dalam gigi tu dia menyebabkan gigi tu tak nampak putih. Extrinsic maksudnya dari keluaran, just tak ada involve kedalaman gigi lah. Macam kita makan ke apa ke, then dia akan buat perubahan gigi warna kita. Next. Okay, so I will just talk to you more about the intrinsic stains. So intrinsic stains ni, we got the types that we call it has it occur from inside out. Maksudnya dari dalam gigi, nampak dari keluaran gigi lah. Tapi dia punya discoloration tu laku dekat dalam gigi. So, so dia can be from macam antibiotic. This is called an antibiotic, nama dia tetracycline lah. Normally pregnant mothers, they consume it, and then when the child is born, they have this called tetracycline stain. So in first 3 years of life, maksudnya 3 tahun dari since born lah, sejak lahir, umur dia 3 tahun, dan gigi dia will call this kind of chocolate kind of staining macam dekat gambar ni. So that is called tetracycline stain. Okay, next. And then we got fluorosis. Fluorosis, rasa sebelum ni Dr. Ramesh ada bagi tahu. So fluorosis ni adalah bila kandungan fluorida tu terlebih dalam badan kita, dan ia akan mengakibatkan gigi kita ni menjadi akibat fluorosis lah. So kita ada 3 jenis, mild, moderate dengan severe. Mild ni kita nampak sikit je dia punya keputihan tu. Then yang severe ni dia sangat yang macam ada macam nampak gigi lubang, tapi dia tak lubang, is because of fluorosis yang dia menjadikan gigi dia tu menjadi macam tu. And warna dia pun lagi macam kecoklatan, macam tak cantik. So we recommend to do whitening for this patient then ataupun bila kita, then the next thing will be yang macam kita dah waktu usia kita ada gigi tu, then we will cause the gigi tu berubah warna. Next. Okay, next is about extrinsic causes. Extrinsic causes ni dari our daily habit lah, macam kita makan, minum. So apa-apa yang kita consume daily, this will cause staining for our teeth lah. So for example, we love to smoke, we love to drink coffee, makanan yang berlemak yang mana ada warna, pewarna lah. So this all akan buat dia punya gigi tu permukaan luar je yang terancam. So dia akan berubah warna. This whatever yang kita makan tu, misal kata kopi tu warna apa? Warna coklat. So then gigi kita pun akan ambil warna yang tu. So kalau kita hisap rokok, Hisap rokok tu dia akan, gigi kita akan ambil warna hisap rokok lama-lama kelamaan lah. It won't happen overnight. It will take time to happen. Okay. So yeah, that's the example of extrinsic dengan intrinsic. Alright, next. So based on the classification tadi, so we got tadi kan ada extrinsic dengan intrinsic cause. So based on that cause, we will suggest you the type of bleaching. So for example, intrinsic cause maksudnya yang akibat kedalaman yang gigi tu berubah warna. So we will suggest you internal bleaching, bleaching dari dalam lah. Kita bukan buat luaran, kita buat dari dalam gigi tu kita akan buat bleaching. So then that is called internal bleaching. So kalau extrinsic cause maksudnya akibat dari keluaran tu gigi tu berubah warna, then we will suggest you external bleaching. Maksudnya bleaching dari keluaran. Kita tak akan sentuh dalam gigi. Just keluaran sahaja. Kita akan sapu dan akan keluarkan dia punya apa-apa yang terlekat dekat permukaan gigi lah. So, and internal bleaching ni pun kita selalunya akan recommend kepada no whiter teeth. No whiter teeth maksudnya gigi yang sudah tidak hidup lah, yang tak ada rasa sakit ke apa. So, dia ada macam kewarnaan hitam-hitam sikit tu. So, normally sometimes gigi tu dah mati. So, kalau kita rasa tak satisfied, tak happy, then we can do the internal bleaching tu. So external bleaching ni normally the gigi is cantik and healthy lah, normally no problem. Okay, then next. So and then tengok gambar ni lah. So this is the type of gambar. So the first picture tu before whitening, nampak warna macam that is normally dari internal kita buat. Gigi ni nampak satu gigi je yang warna dia nampak macam hitam sikit. It's because gigi tu mungkin ada trauma ataupun gigi tu just lama kelamaan tu dia jadi macam no whiter because of trauma. So bila jadi macam ni, over the time patient rasa tak happy, tak confident, then we will go with internal bleaching. Internal bleaching tu hanya gigi itu sahaja kita akan buat lah. So then tengok gambar kanan je dia jadi putih. So it's very dah cantik lah. And then bila dah buat internal bleaching tu, you rasa you want to do the whole thing, your whole mouth tu, then you can go for external bleaching. External bleaching macam gambar bawah tu lah. Gambar bawah belah kiri, dia overall dia nampak lagi kecoklatan. So bila dah buat bleaching dia nampak lagi cerah dan lagi sehat lah. Alright, next. So what is whitening ni? Whitening ni dan dalam kita selalunya pakai chemical ni. Chemical tu we call it as hydrogen peroxide. Dia is not hazardous to the body, but on over kita only can use ada percentage yang kita boleh pakai lah. Kalau lebih daripada percentage tu is very harmful to us and the teeth. So the percentage is only recommended is for hydrogen peroxide is 35%, ataupun yang lagi satu kita panggil dia carbon peroxide called also 35%. And then kita ada dia punya teknik whitening ni, kita ada setting dia lah. We can do it in the clinic or patient yang datang sini kita akan buat dekat kita akan fabricate some special custom tray untuk dia. Then the patient tu can balik rumah dan buat pakai dia punya bahan ni dekat rumah. Tapi whichever that you are bringing back to home, the percentage of this peroxide will be lesser because dekat rumah kita we cannot control the usage tu. So dekat klinik macam doktor kita sini were professional, so we know how to control the usage of the chemical because overuse is very hazardous to us. So for example dekat macam whitening outpatient. Next. So whitening outpatient, normally we do what is when the first patient datang, kita akan ambil dia punya acuan gigi. Pasti kita akan buat macam special tray, dia macam putih je lah. So macam retainer lepas kita pakai gigi braces tu, it will be something like that. So then yang tu kita akan bagi patient, lepas tu patient kita akan bagi dia punya peroxide ni yang either hydrogen peroxide ke ataupun yang mana-mana. Lepas tu patient dekat rumah boleh pakai untuk boleh pakai sapu dekat atas dia punya the tray tu, yang tray tu, then you can use it for every night for 20 to 30 days. Tapi sebelum all this whitening you do, you have to come and get your teeth clean lah, polish dengan scaling. So kalau you don't do polishing atau scaling dekat klinik, then you just straight away you go and do whitening, is not effective at all. Sama juga. So you have to come and do the basic management dekat klinik dulu, dapatkan your scaling and polishing first, and then only this whitening will be effective on your teeth. So you can see on the picture too, the tray yang I was saying is the white transparent like tray. So this tray we will fabricate it customly for you, and then you can bring it back home. We will give you this chemical, the peroxide. You can apply it on the tray and then you can use it in the night. After brushing your teeth semua, you pakai benda ni malam lah. So you can use for however long you want to use it. So for about 20 or 30 days, you can use it for a month until you are satisfied with the results. Okay, so this will be, the results will be slightly lesser than the one we do it in the clinic. So the clinic one is called, next, whitening clinic. So whitening clinic is where we do it in the clinic by the professionals or the doctors lah, dentist dekat klinik klinik gigi bukan mana-mana hotel or anywhere else lah. It's a professional dental chair site setting punya whitening. So normally this whitening will take about an hour to 1 hour, depends on the cycle that you prefer. So the whitening we pakai is the same thing, but the content of the peroxides will be more, as the one that you use at home. So then we will call you here, and then we will do the scaling and polishing, as I said, and then we will apply like a barrier on your gums. Okay, this barrier will be placed on your gums, and then we will take the next picture, yeah. We will take this called the shade selection. Before we proceed to the whitening, we will choose the shade selection. We will show you first how is your tooth color. So let's say gigi adik ke kawan-kawan yang kat sana is like macam yellowish. So the shade tu when we do, we will take the picture before first. So this is your shade. Then after we do the whitening, we will show you the shade after whitening. So it will be normally 2 to 3 shades lighter. So initially kalau dia kuning, lepas buat whitening, it will be a bit more whitish. Okay, but semua ni depends on your gigi. Kalau gigi you is different from everyone. Some people can take it very fast, some people cannot take it very fast. And yang tu yang that's why you cannot say that kenapa gigi dia lagi putih but my gigi tak jadi putih. So you cannot say that because every individuality is lain-lain lah. Okay, so when you come and then we will put the barrier to the gingival barrier we call it, and then we will apply this whitening gel onto your tooth surface. Okay, we will apply it, then leave it for about 15 minutes. Okay, different types of whitening, they have different types of leave on time. So for example that we use here is about, we leave it for about 15 minutes and then we wash it off. And then we go to the second cycle. The second cycle is the same thing. We just wash off the first layer and then we apply a new layer and then leave it for another 15 minutes. Okay, so this is 2 cycles. If you want to go for a more whiter shade, then you have to go for another round of cycle. It depends however white you want, that many cycles you have to go. Okay, so yeah, so then as long as you're satisfied with the shade that you want, then that's when we will start applying the gel on your teeth. Okay, so yeah, all right. So macam why do we do whitening? So normally we are not happy dengan gigi kita tu, so we normally want to do untuk kecantikan lah kan. So rasa nak buat gigi cantik, rasa tak putih sangat gigi tu, then we recommend, then you can do this. Alright. So apa dia punya after buat whitening ni, normally you will have sensitivity masa we apply the gel on your teeth pun you will already start experiencing the sensitivity yang sangat ngilu, you cannot tahan tu it's because the chemical ni dia reacting onto your tooth punya structures there, okay, the bonding, the reaction between the chemical and your tooth structure, so that's why you feel very sensitive, sangat ngilu macam tu. So this sensitivity might be there depending on the individual. Satu patient ni maybe 2-3 hari je, lepas tu dah tak ada. But then some people maybe 2 minggu pun dia ada sensitivity tu. But this is memang the normal reaction that will happen. But after that, it will be normal lah. Okay, so yeah. And then whitening ni, that this procedure of whitening after you do, it depends how long it can last on you. Macam kalau kita jaga dia, kita macam don't makanan kita semua, kalau kita dah makan cepat kumur, jangan biar je macam tu. So the whitening process yang kita buat dekat sini ataupun dekat rumah yang kita buat boleh tahan lagi lama lah. So it can last about 3 to 6 months So yeah, if we jaga dia, kalau we don't take care of it, then it will just last for about 6 months. Okay, so yeah, this is all for today. That's the whitening lah. That's the whitening procedure and the why we do whitening for. So yeah, so thank you.
Hai semua, jangan lupa like FB My Dental Care, follow Instagram My Dental Care dan juga subscribe YouTube channel My Dental Care. Captain Gigi to the rescue.